Welcome back to Daytime Ottawa. We're just discussing, racial inequalities, and now we're going to talk inequalities when it comes to women's health, in particular heart and brain health. And here to tell us more about it and some of the latest studies and statistics, I'm joined by Dr. Glenn Pyle. He is a molecular cardiology researcher and professor of biomedical sciences and biophysics at the University of Guelph. Welcome to the show. Great to have you here, Glenn. Really appreciate the time. And let's start off talking about some of those inequalities. What do we know about inequalities when it comes to women's health, when it comes to brain and heart health, in particular, Glenn?
So we know it stretches across the entire system. We know that women and society in general are less aware that women can have heart disease and stroke. Only 40% of Canadians know it's the leading cause of death amongst women. We know that there's less research invested into women's heart health, and women's heart health is actually different than men's. There are some unique circumstances, and we know that women are less likely to receive appropriate care as they move through the system once they develop heart disease or stroke.
Dr. Pyle, why do we see the difference in research numbers when it comes to men and women? Do we have any idea why?
Well, I think historically the assumption has been, if you have something like a heart attack is a heart attack. It doesn't matter if you're a man or a woman. And yet what we're discovering is there are significant differences between men and women, both younger individuals, but especially as people age and their risk for cardiovascular disease rises. The bodies are very different. Their hearts are actually quite different. And so they respond differently to things like heart attacks or stroke, but they also respond differently potentially to treatments. And we just simply don't know what those differences are because we haven't done the research to investigate them.
When it comes to symptoms, my understanding is that the symptoms are quite different between men and women as well. Can you describe that for me?
Yeah, they can be.
Okay.
So we certainly know the most common symptom that people associate with something like a heart attack, for example, is chest pain. Women do experience chest pain. They can experience that pain, but they also experience things like pain in their jaw or their shoulder or into their arm. So when they present to the emergency room and they say, I have pain in my jaw, the immediate thought isn't, well, it must be a heart attack, in large part because it's an unusual symptom that most people aren't familiar with it. But also still are perceived as not being at risk for cardiovascular disease. So it's not something that comes to mind, whether it's somebody working in the hospital or women themselves when they're experiencing these events.
As I ask you the next question, Glenn, I'm just going to ask you to refresh your browser again. You're cutting in and out just a little bit for us. So just do that, and I'll throw in my next question as you come back here. Again, we're talking to Dr. Glenn Pyle. So, Glenn, my understanding, too, is there is some sort of intersection between your research and what we're talking about. What is that intersection in this particular subject matter?
Yeah, so we're interested in how men and women respond, or how males and females respond differently to heart attacks. Right now, we're focused on menopause. We know that after menopause, the risk for cardiovascular disease rises in women, and we know that outcomes are worse. So what we mean by that is women generally go through menopause at about age 50. So if you take a man and a woman who are about, say, 55 years of age, and they both have a heart attack, the woman is more likely to die after that heart attack, either immediately or within the next year or so after that. And so our question is, why is this happening? It's not because of age, because we have a equivalently aged man, and yet the woman's more likely to die. So we're trying to understand how it is that menopause impacts the heart and impacts its ability to respond to diseases. So
as part of your initiative then, Glenn, is to get more research done? I mean, are you working with different partners across the country? How can we fix this research issue?
Yeah, so we're working with Heart Stroke Foundation of Canada. They do support our research, and we're working to improve cardiovascular disease research across the spectrum. So to do more education so that women are aware of their risks, but also so the healthcare practitioners are aware. They're actually not aware of all the risks that women face, and then obviously the people around women. So there's an education component. We want more investment in research so that we can begin to investigate these differences between men and women, understand them so we can treat them better. And then we want to transform the healthcare system so that we can dismantle these inequities that women face really from the moment that they walk into the hospital until the point that they're discharged. They're actually less likely to receive cardiac rehabilitation, for example.
Dr. Pyle, we've concentrated a lot on the heart. You know, part of this study too was on brain health. I imagine that's the stroke side of things. When it comes to stroke, do we see similar situations where perhaps the symptoms may be different between men and women?
So yes, again, we see this inequity in all different types of cardiovascular disease, whether it's heart disease or stroke.
Okay.
Again, we know that there are differences in how men and women respond to these stressors. Some of it are the symptoms. Some of it, for example, might be the treatments that a treatment might work well for a man with a particular condition and not a woman, but also vice versa. And so that's why we need more research into these areas. First, to increase the awareness so that people recognize, what are the signs of a stroke? What are the signs of a heart attack? But then to also educate healthcare practitioners and to do more research so that they have the tools to manage these patients better and design therapies that are specific for males or for females.
Yeah, because I wonder, is recovery then different between men and women? So yes, in some ways it is. The interesting thing is women are less likely to go through the rehabilitation process. Part of that is that they may not be referred, so they may not actually get into the system. They're less likely to complete their rehabilitation. Some of that is the support systems that they have around them, and they may not, to move through it. Some of it are just the different stressors in life. We know, for example, that women are more likely to take on responsibilities at home, whether it's caring for other individuals in their home and so forth. And so they just feel they don't have the time to go through the process. Dr. Pyle, really appreciate the time today. Thanks so much for joining us. We're going to be talking more health coming up right after this. Don't go anywhere.